Okay, welcome everyone. Let's get started. So thank you so much for joining us today. I'm Dr. Giselle Withers. I'm a clinical psychologist and I'm the founder of A Mindful Way, an online platform dedicated to sleep improvement. Alongside my work at A Mindful Way, I also run a private practice called Evoca Health, and that's based in Kingscliff and on the Gold Coast. And I see people Australia-wide via telehealth with that. So I'm really passionate about helping women navigate perimenopause to experience better sleep. Having been through my own sleep challenges during this time in life, I know the toll that it takes on mental health and physical health. So I really hope that you find this workshop useful and helpful, and all the other resources we have available at A Mindful Way. And I'm really delighted to introduce my co-host for the workshop today, Dr. Moira Junger. Moira is she's a clinical associate professor, Junger. She's a health psychologist and she's the CEO of the Sleep Health Foundation. She's also on the Healthy Life Health Advisory Board, and she has a background in nursing and psychology with 25 years experience in helping and supporting health behaviour change. And she now leads national efforts in sleep health advocacy and education. So you have a wealth of knowledge, Moira, about sleep, and I'm so glad that you're here to share some of those pearls of wisdom with our participants today. So thank you very much for joining us. Would you like to introduce yourself, Moira?
Thank you, Giselle. Yes, it's a great honour to be here. So I will be in your hands and really enjoy the content as well and contribute where I can. But yeah, thank you for the invitation to be part of it.
It's always great to hear your perspective. So I'm really thrilled that you can join us. And Moira and I would like you to know that we believe that sleep disturbances in midlife is not just part of getting older. That we hope that today's workshop will help you with knowledge and with tools to support better sleep to help you feel yourself again. So before we dive into the content today, there's a few things that I'd like to mention. So I'm just going to share my screen to those with you. So just give me a moment. Right, so Moira and I would like to acknowledge the traditional custodians of the land on which we work and live, and we pay our respects to their elders, past, present, and emerging, and we extend our respect to all Aboriginal and Torres Strait Islander peoples, with a warm welcome to those who are joining us today. So we welcome everyone from all backgrounds and experiences, and you'll hear us use the gender terms of female and women or woman in this webinar. I want to acknowledge that these terms don't necessarily include all people, including those assigned female at birth, trans and gender diverse people. So where possible, we do intend to use inclusive language. We believe that we're a stronger community when everyone feels heard and valued. So the session is being recorded. If privacy is important to you, please know that you are welcome to keep your camera off, and you can hide your identity by changing your name on the screen. And please make sure your microphone is muted throughout the presentation or the workshop today. We wanted to make this workshop as practical and helpful as possible so you can walk away with some tangible tools to use right away. So I sent out a worksheet last night, and it's called your personalised sleep plan. So you can complete that during the workshop. If you didn't get a copy of that or haven't had a chance to take a look at it, I popped it in the chat so you can download that and refer to it during the webinar, and just use a pen and paper to make any comments on that and refer to that. We do have the chat feature enabled today, so please type any questions that you might have in that chat function. And we do aim to leave about 15 minutes at the end of the presentation today for questions. So just a reminder, this information that we share in the workshop is not intended to be a substitute for proper diagnosis or treatment by a health professional. So please seek the advice of a doctor if you have any sleep problems and need specific answers about your sleep health. Okay, so we have a lot to cover today, and we're going to dive right in to make this as practical as possible. The things we plan to cover today is we'll look at healthy sleep and look at how much sleep is enough. Then I'll talk about the common causes of disturbed sleep during perimenopause and menopause and the role that changing hormones might have on your sleep. So we'll then discuss mind-body approaches, including mindfulness techniques and approaches for better sleep and how to settle your mind and body when you're not sleeping well. And this includes managing hot flushes and night sweats at night time. And then we allow time at the end for your questions. Would really like to hear from you what would be helpful. So this is only an introductory workshop. If you do need more help with your sleep, then you can consider one of the courses that we have available at A Mindful Way. So I won't talk at length about these, just briefly that we have an online program that is called A Mindful Way to Healthy Sleep. It's a 6-week course and it's available on demand, so you can start that at any time. And it's a comprehensive program that combines cognitive behavioral therapy for insomnia or CBTI skills with mindfulness training. Please take a look at the content on my website at amindfulway.com.au. And just to say here that this program has been independently researched by a research team, the sleep research team at Monash University. And they found that 83% of people who participated and completed this program achieved a significant improvement in their sleep, and they were very satisfied with that outcome. And 75% of achieved a full remission, so they had no insomnia symptoms at the end of the program. So really good results and making this an evidence-based program. And we have a second program called Restful Nights Through Perimenopause. So this is really tailored for women like you. What it involves is 2 one-to-one sessions with me. So we'll have a full hour twice at the start and the end of the program, and to talk about your unique sleep challenges and what you may uniquely need to help you overcome those. And you'll also have 12 months access to the A Mindful Way to Healthy Sleep online course. And as you're doing the online course, I'll be taking you for 4 weeks. So it's a guided program for 1 hour over 4 weeks, and I'll be taking 10 women through that for support and coaching and any support or advice that you need along the way. So a really supportive and intensive program for 10 people. That starts next Friday. So if you're interested in that program, registrations close this coming Tuesday. So please jump on the website and take a look at that and see if that's something of interest to you. So we're going to start today by getting to know you a little. It's always difficult on Zoom to have a sense of who's there and the sleep needs that you have. So I'm going to hand over to Moy and we'll just undertake a poll now, which you can answer anonymously to. We're going to ask you about how much sleep that you're currently getting and how much sleep you feel like you need. So I'm handing over to you, Moy, just to start that poll.
Right. Yeah, we had. Okay, well, it doesn't. I'll read through what I've found on the results. So we had 67% of people. We asked you over the past month how much sleep have you been getting each night. 67% said around 5 hours, and 33% said around 6 hours. And in terms of how much sleep do you feel you need, most people, 50% said around 6 hours, 50% around 7 hours. And then not at all satisfied, of course, into how satisfied are you with your current sleep. We anticipate that most people wouldn't be that satisfied. So that's exactly why you're here and why we are doing this and why Giselle's doing this amazing work in this space for women just like you. So that's no surprises there,
Thanks,
Giselle.
Yes. So a lot of people are not satisfied with their sleep, as you said, and not getting the sleep that they need. But Maura, I'd love to hear from you about what amount of sleep is normal and what does normal sleep look like
Yeah,
at this
it's
stage?
such a good question. And yeah, it was good to see that most people weren't sort of having high expectations of thinking they needed 8 hours or more. Because you'll see this graph here. This is from the National Sleep Foundation over in the USA. And it's really useful to look at across the lifespan from babies right through to older people, what the recommendations are, and indeed, for health, what sort of durations we need. So the dark blue is what's recommended here, like for most people in the room here, particularly we're talking about menopausal women. So we're talking about sort of this age group here. So 7 to 9 hours is what's recommended, but it's really important to see those teal colours of 6 to 10 is the range as well. So there are outliers who are considered normal, and we don't put that much emphasis on duration. It's actually about the consistency and the quality and the timing as well. So go to the next slide, Giselle, and have a look at sleep in terms of quality and what we're talking about, what normal sleep looks like. Again, duration is just one aspect. It's really nice to look at graphs like this where we can see across the night this person's sleeping from 10 till 6, but not everyone does sleep in those hours, but say a typical time frame. And you'll see in the first half of the night, lots of deeper sleep. Like, this person starts up at wake, and then there's a nice, gentle up and down, up and down, up and down throughout light and deep sleep. And then as the sleep progresses, like the latter half of the night, there's more and more REM periods. So these lines of the REM, the rapid eye movement sleep, the stage of REM is where most of our dreaming occurs, and it's really good quality sleep, but it's very light. It's very light, like the rest of this, back up to stages, the light stages of sleep. So you don't get deep sleep again in the latter half of the night. And of course, look at all these. There's lots of wakings, there's lots of light, and lots of REM. So it's very hard, particularly if you've gone to the toilet or something, you come back and you think, oh, I never really went to sleep again. But a sleep study might show that you actually are in dozy, light sleep. So that's something to think about too as we progress through the content today. And there's another slide I'll just finish off on before I hand back to Giselle. So we know that most adults around the world, we say most adults have a recommendation of 7 to 9 hours, but it's really important that you've seen there's lots of variation. 6 might be absolutely fine for you. So some of you were around that, which is really nice to see. And we do need less sleep as we age, but not dramatically. It's not like we go down from needing 8 and then we only need 6. It's fairly stable as you saw, across the lifespan. And we do have lots of light and lots of deep sleep, and it's most of the deep sleep's in the first half of the night. So it's really important to think about this. Waking up 3 or 4 times is normal, but probably even more sometimes when we change body positions. Otherwise, we'd have a pressure sore in our ear and things like that. And we know clinically, like Giselle and I have worked clinically together for a number of years in the past, and I don't think it's anything abnormal in someone not getting to sleep for 20, 30 minutes. Like, it's fairly typical to take 20 or 30 minutes at least to go to sleep. And then we can start talking about that later. So these are the good facts for you to know, and that sleep is driven by so many other things, not just our busy minds and our hormones, but just our circadian system, our sleep drive, and just really exactly how relaxed we are as well. So I'll hand that back to you, Giselle, because I know you've got so many more great things to talk about.
Thank you. And I think just with the poll probably took a little bit longer than we were expecting. So I'm actually going to skip this poll for now.
Yeah, I think so too.
Yeah, so we might come back. I've got a poll a bit later we might use. But really what we want to talk about now, is why you're here, is the common sleep problems that occur during perimenopause, this stage of life. And I'll talk a bit about what perimenopause is in a moment. But first, to say that it is so common to have sleep problems at this time. Around half of women going through perimenopause, and actually 60% of postmenopausal women have sleep issues. So that is huge. And it's such a common factor that it's actually seen as a core symptom of menopause. It's almost expected that this sleep disturbance is going to occur. Now, what the most common issues are when people are not sleeping well is having trouble getting to sleep. So it can find it hard switching off the mind and winding down, and some women can take a few hours to get to sleep, so that can be a big problem. But predominantly, what seems to be more of a problem for most people is the waking up in the middle of the night, particularly around sort of 2 or 3 in the morning, and finding it really difficult to get back to sleep, or quite restless sleep, waking up a lot, like very frequently during the night. The last problem often people have is the waking up too early. So finding at 3 or 4 in the morning, that's the last time you wake up and you can't get back to sleep after that. And then there's the fatigue and tiredness, and then the feeling of unrefreshed sleep is a really common symptom as well. So these are, 50% of women might experience some form of this. Now, it reaches a clinical diagnosis of insomnia disorder if that pattern of having trouble getting to sleep, staying asleep, or waking too early, or having unrefreshed sleep goes on for more than 3 months, and it's happening for 3 or more nights in a week. So that is actually, again, fairly common. So depending on the study, some studies will say about 26% have the full insomnia disorder, but other studies are showing around 40 and higher percent will have that. So insomnia disorder is very common at this stage of life. There are two other types of sleep disturbances that increase around perimenopause, and that is obstructive sleep apnea. So that's when our airways become slightly obstructed while we're sleeping. That might take the form of snoring. But you can have sleep apnea without, an audible snore. So it is important to remember that you can't rule it out just because you're not snoring. And the research has shown that actually in perimenopause, just as many women as men will have this condition. So it's really up to 36% in perimenopause and up to 53%, or around 53% in one study, postmenopause. So most people think about this as a male problem. Actually, we need to be thinking seriously about that as women, and talk to the GP about having an overnight sleep study, and there are treatments available for that. Now, the last one that's quite common, or at least it increases in perimenopause, is restless leg syndrome, or a cousin of that, periodic leg movements, which is the feeling that you need to move your legs to get comfortable. And that really goes up at this time in life as well. And I'm going to talk a bit about why these sleep disturbances increase at this time of life. There are many reasons, and Moira and I are going to talk about all of those reasons, but the one that I want to talk most about, which is the obvious thing that's changing, which is our hormones. Now, as I talk about the causes of sleep problems, you can take a look at your personalized sleep plan, and there's a range of different causes that I've listed in that, and you can have a look at those and tick them off, and you'll see I've categorized them into predisposing factors, which put you at a risk of having a sleep disorder, and then the precipitating factors, which is what triggers it. And then we're going to talk about maintaining factors, the things that keep insomnia going. So you can have a think about those three categories. So what's happening in perimenopause and menopause with hormones? First, I'll just define menopause. It is the time when our menstrual periods cease, 12 months from the day that our menstrual periods cease. So if you haven't had a period for 12 months, you're considered to be in menopause. And the time leading, or I should say the average age of menopause in Australia is around 51, but the time factor can vary. So it can be sort of 10 years either side of that. Now, perimenopause is the time leading up to menopause. And again, that can be anywhere up to about 10 years before you reach menopause, but most people will start to really notice symptoms in the few years before they reach menopause. So in this graph, it shows you the really different stages in life where hormones are really different. So on the left-hand side, it says premenopause, and that is our reproductive years. So you can see that the hormones, with the green one being estrogen and the dark blue one being progesterone, they follow a nice regular pattern that matches our menstrual cycles. And it's a pretty consistent pattern. Then as we finish our reproductive years and we start entering what's called perimenopause, those hormones start to change in that there's no regular production anymore. Estrogen is really quite erratic. It can sort of rise just spontaneously and decrease. It can spike, so it even goes higher than it was during the menstrual periods. And then as it reaches menopause, it just rapidly declines. And you can see there's a very low and stable amount of estrogen post-menopause. And you can see with the progesterone, again, it starts to just slowly decline over the period time of our perimenopause. So, what is happening when these hormones change, and what impact is that having on sleep? Most people don't realize that hormones are very much, well, they affect every part of our body and our functioning, but they're really important in regulating our sleep. So, estrogen and progesterone, they help to regulate our circadian rhythm pattern. And these are functions that follow a 24-hour cycle. So these are things like our sleep wake cycle, which follows a 24-hour rhythm, our body temperature. Again, usually body temperature rises in the daytime and should drop down low at nighttime. And things like melatonin production, which will rise towards the end of the day to help us sleep. And then cortisol, which should be higher in the daytime and low at night. So when we have these rapid changes in hormones, it really affects our sleep-wake cycle and our body temperature regulation and the release of melatonin and cortisol. So as estrogen drops, then we might have less melatonin and then it's harder to fall asleep. When progesterone drops, it has a less of a calming effect in our body. It's often seen as the calming hormone. Cortisol starts to become erratic, so you might find yourself completely wired in the middle of the night because your cortisol levels might be spiking. And poor sleep then starts to raise cortisol further. So people will often find when they're not sleeping well, they have high levels of cortisol at nighttime, and that's our alerting hormone. So that's also a reason why we're much wider awake at that time. So when we get hot flushes and night sweats, this is because the changes in estrogen is affecting our body's thermostat, so our body temperature regulation. And when there's a rapid shift in estrogen, then you might find there's just a sudden shift in body temperature. Either the body temperature goes up rapidly and you start sweating and trying to cool down, or you can get a drop in body temperature and have the cold kind of shiver feeling. That can seem quite random, but there can also be a range of triggers that cause that. So it's one of the reasons why we look at trying to avoid caffeine at nighttime. Well, really, I try to encourage people not to have coffee at all during the day, but just keep it in the morning. Alcohol can have an impact on that. Having a hot shower at night time can impact on hot flushes or hot drinks. So these are the kind of tips and strategies that can help you mitigate the potential risk of a hot flush. Then again, they can still continue when you're doing all the right things. So I do have a blog on the website where I talk about ways to manage hot flushes, and it's also in the guide. I have a guide to better sleep through perimenopause. There's a section on managing hot flushes in that too. So it is a problem for a lot of women. It can really interrupt sleep. You might wake up feeling just drenched in sweat. And not only is that inconvenient to need to change clothes and sometimes bedding, but also that can really increase emotional arousal, like more frustration or feeling, just really, frustrated, angry, anxious about how long it's going to go for. And this emotional arousal can also interfere with sleep. So, what I'm going to talk about in terms of having strategies to reduce stress, arousal, tension at nighttime to help you wind down for sleep will also be very, very, very beneficial for helping managing hot flushes as well. I didn't mention these statistics. You might have been reading this slide as I was talking, but hot flushes are quite common. So 60 to 80% of women will have these and could have 3 to 4 a night. Not all hot flushes will wake you up. So about 75% do lead, 70% lead to an awakening, and it can leave women awake for on average around 17 minutes. As Moira said, it is very common though if you wake up at nighttime to take about 20 minutes to fall back to sleep as well. And of course, some women are not bothered by them at all. So it's not a direct correlation from a hot flush to disturbed sleep. This is when we can learn from what these people are doing that's working well. Now, hormones, so poor sleep is not just about hormone changes. It can also be about many of the other changes happening in your life. It is a really tough time in life. And I'm going to hand back to Moira to talk a bit more about what is impacting on sleep beyond hormones. That's a lot more about what our life stage. So over to you, Moira, just to talk to this slide, if that's okay.
Yeah, sure. It was great just to, yeah, just thanks for taking us through the actual hormonal changes and what's perimenopause and what's menopause. And I think it's a really good point that there are these other things that happen at this stage of life. Like often women are, it's kind of like the sandwich generation that you might be squashed with, sort of still got elderly parents or parents that are aging and you're thinking about them and the, dependent children and children are staying longer at home. And so there's a lot of busyness and women do in general take on the lion's share of the caring responsibilities and the household stuff. And of course, not in all cases, but it is mostly true to say that. So there's these, work pressures and, financial pressures, all that sort of stuff. And we find ourselves as just getting older anyway, and you can actually have more aches and pains, putting on weight, regardless of whether it, I mean, often it's a hormonal thing, but sometimes because you're so busy, not doing your exercise, etc. Limitations in our physical capacity, like perhaps not as fast as that with our running, or we've got, that sore shoulder or that sore hammy and the things that impede us being able to do what we used to do. And I think that's the highest rates of depression and anxiety for women are around that menopausal age. So that there are mental health concerns and increased risks of mental health issues because of these life stresses and that hyper arousal. So just being, you may not be full blown anxiety disorder or depression, but just feeling unsettled and agitated and wired and those sorts of things affect our sleep as well, regardless of where you're at with your hormones. And I think that there are, not sure if you've noticed this, but I've noticed it as I've got older that there are cultural and societal attitudes towards aging in general, and women as well. Like it's interesting, isn't it? The Karen, there's a bit of it. There's even a name for sort of an old grumpy woman. Not sure there's not a Kevin. So there are sort of some interesting things that are going on outside the hormones in this life stage for us. Um, Next stage, yeah, next slide. Because I think this is a nice slide. I think there is a lot of strengths as well. I think it's a really positive. You can tell already Giselle's a very positive person. I think all of her work is, and mindfulness is a very positive framework as well. Well, sort of acceptance framework of where we're at. And I think with midlife, there is more wisdom and there's that life experience. There's still personal growth. We don't just sort of stop when we're a teenager or when we're 20s. We're still developing our wisdom. There is that seniority sometimes with that respect at work, like senior roles, and people will start to, in many ways, really look up to us as leaders, as women, leaders in our families, leaders in the workplace. An increased confidence that you've got. You don't really care so much anymore about upsetting people or treading on toes. It's like, well, no, I've got that confidence to be able to find my voice. And in many cases, there is generally, by the time we've got this, it's not always, of course, but can have financial security, can have got a lot of career satisfaction, a lot of think, well, looking towards maybe the end of your career and that job security because of that experience and wisdom and qualifications you've had over many decades. So there's lots of strengths and lots of gains to be had in midlife. And I can wish we could see you, but I can see it in Giselle. I think, wow, Giselle tells me all the time about her surfing. I think that's just so fantastic that women in the 50s and 60s and 70s should be surfing. It shouldn't be a surprise. So back to you, Giselle.
Start surfing at any age, and even if you stay on the water all the time, it is still fun. Yeah. Thank you. Thanks for that, Moira. So you've got a sense of the different things that can cause and precipitate and start insomnia, but we move into a different territory when we talk about look at things that actually now maintain the problem. So you might still have some precipitating factors, like the hot flashes might still be interfering with sleep, and there are things you can do to help mitigate that, but you can't necessarily there's not always ways to change those hot flashes. For some women, hormonal therapy can be really useful, and for others, it's not as effective. But what I'm about to talk about now, are things that we do have a bit more control over, and these are things that we can learn about and manage that don't add to the sleep issue. So one of all the research has shown that people who have chronic insomnia also seem to get caught, it's happened to any of us, in a vicious cycle. And what that means is when you've had a period of time when you're not sleeping well, we do start to develop really unhelpful thoughts about it and just reactions that kind of make the problem worse. So, it's really common to have the thought, I must get to sleep now, or tomorrow is going to be awful. I'm not going to function. And while it might be true that it's going to be a really difficult day, some of our thoughts can, I guess, blow those expectations of the day out of proportion, where we feel like we're going to make a major mistake at work, or that we're just not going to be able to cope and do the things we need to do. So that can lead to emotions like anxiety and frustration, or anger, or disappointment, or if you've been there for a while, and even a sense of hopelessness that I just can't seem to get a way out of, I can't find a way out of this. Those emotions then have an impact on our body as well, in the sense that they activate our arousal system. So that's an increase in heart rate and breathing rate and body temperature and muscle tension. It's really activating that stress response in the body, which we call hyperarousal. And that has an alerting effect. It makes us feel more awake. And what it also tends to do is we can be led into behaviors that are unhelpful. We're trying to get ourselves back to sleep, but we might be checking the clock or jumping on the phone and scrolling, thinking that that's winding us down, but actually it's quite stimulating on the brain. We actually try really hard to sleep. Maybe we even start using things like alcohol to help wind down at night time, but that has detrimental effect on sleep. Or we use coffee a lot more in the day to keep us alert and going, and that then impacts on sleep as well. So this cycle is often what keeps insomnia going. And there's this additional layer that happens as we get more entrenched in this cycle. We get caught in what's called a sleep paradox, that the harder we try to sleep, the more wakeful we become. So the more pressure that we put on sleep, the more we're actually getting in the way of our body's own natural processes to sleep. So most of us get through life with hard work and determination, and it's natural for us to think about applying the same approach to sleep, like doing more to try to fix the problem, doing all the things we can to try to sleep. But the problem is, sleep is not something that we do. It's really a natural process that happens when the conditions are right. So like breathing or digesting food, our brain regulates sleep without us even needing to think about it. So the more we keep trying to do sleep and try to sleep, we really actually add to the stress and the pressure, and it adds to this cycle that we can get into, and it helps make this maintain sleep. So again, I would have loved to have done a poll to find out what you're already doing to improve your sleep, but I really actually think we should keep going with the content, because we are, we've got 20 minutes to go in the session. So what I'll do is continue on, and then if we've got time after questions for a poll, I'll find out your answer to this, because I would love to know what you've already tried to do to improve your sleep, because there are lots of things that people have tried. And maybe Moira, you could just say a few words about what people do to try to sleep, and then I can talk about what works and what doesn't.
Yeah. Well, mostly people aren't doing what you're about to talk about. Mostly people haven't really heard about the gold standard things that we know where the evidence is. So most people would be guided by things on social media. People would be trying, well, sleeping pills, for instance, is the most common one in Australia. And they're not terribly, if they're not necessarily the first line treatment, and medical doctors would agree that they are for usually sort of just either emergency short-term work use, or intermittent every now and then kind of special occasion use. So yeah, there's all sorts of things like sleepy girl mocktails and mouth taping and earthing blankets and magnesium supplements, melatonin supplements, lots and lots of stuff. I'm sure if we ask people, they'd be talking about that, and we can talk about that later I'm sure they'll be in the Q&A for sure. Those sorts of things. But we know that where the evidence is is where Giselle's about to tell us where the evidence is and what we know will work. And not to be disparaging other things, but just that the evidence isn't there yet for many of the other things.
Mm.
Back to you, Giselle.
More, yeah, so the evidence really, the gold standard approach, and it's recommended by all the bodies like the Australasian Sleep Association, the Australian Psychological Society, all the medical bodies really have evaluated the research and found the most effective treatment for insomnia is cognitive behavioral therapy for insomnia, and the mindfulness-based cognitive behavioral therapy for insomnia, because it has additional mindfulness training, which I believe actually enhances the effects of cognitive behavioral therapy for insomnia, which I'll say CBTI for short. So these two approaches are the gold standard. Um, because of the time we have for a 1 hour workshop, there's not enough time to explain a full CBTI or mindfulness-based CBTI model. But what I will say, I'll take some key components of that and I'm going to present it in a moment through a case study to show you just the first steps and things that you can start to do to implement the elements of the mindfulness-based CBTI approach. So just to say though, if you're ready to dive in and you want to learn more about mindfulness-based CBTI, this is where the online program comes in. I deliver the full program to camera, so I've had that professionally filmed. It's the program that I used to run face-to-face in groups, and all really now just available for people to go through in their own time when they're ready. Often people will watch the videos, and it has all the components of CBTI and mindfulness with a range of meditation recordings. It's really structured mindfulness training, a lot of resources that come with this program. So it's over 6 weeks. It's available on demand at amindfulway.com.au. To add there, I think I've really talked to. I don't want to go too much into this, but this is something that you could try at any time. And if you want more support, though, if you feel that actually having the one-to-one input and being with a group of 10 other women who are going through the program and it's more tailored towards perimenopause, then you could join the group program starting Friday, as I mentioned earlier, and registrations for that close this Tuesday. I'm happy to answer any emails or even jump on a call with you if you'd like to discuss this program to see if it's right for you. So I just wanted to pop in some reviews for the A Mindful Way program. I talked about the research for it earlier, but we've got some great reviews on Google for that. These are unsolicited reviews. And I had a colleague who is a clinical professor, Leanne Rowe, who said, I frequently recommend Giselle's specialized sleep program to my clients and my colleagues, and I use it for myself. So that was a really nice feedback from her. So let me talk about how you can start implementing mindfulness-based CBTI even tonight. And I'm going to take you through 4 steps. I'm kind of breaking it into 4 steps, and you can use your personalized sleep plan that I sent out to you to start writing some of these steps down if you find that they resonate and if they're helpful for you. So the case study is Sally. She's a 48-year-old. She's professional, married with 2 children. She has these sleep problems that means that she's only sleeping for about 5 hours a night, but she's 8 hours in bed. She's really fearing that this is going to impact on her work performance the next day. She's very health conscious, so she doesn't have coffee or alcohol, and she exercises and she's doing all the right sleep hygiene things, but her sleep is persisting. Now, she's already trying a lot to help herself sleep better. And as you now know, she's caught in this insomnia cycle. So she's having these thoughts like, if I don't sleep now, I'm going to make a major career-ending mistake at work tomorrow. So she's very anxious. The anxiety is waking her up. She's got all these physical sensations too, and she's checking the clock. She's really trying meditation, but trying apps and things, but to get to sleep. And so when the mindfulness or meditation's not working, she's feeling like this isn't working. And so using it as a tool to get to sleep actually only adds to the frustration. So she's caught in this, like she's trying really hard to get to sleep, and the more she's trying, the more awake that she becomes. So what Sally needs to recognize is this step 2, and I'll just say that step 1 really for any of you going through this is to recognize I'm caught in that insomnia cycle that I heard about on that workshop today. So just recognizing you're in it is a really good start. The second thing is to see that there's a sleep paradox here, that the more I try, the worse this problem gets. So that is, it sounds like a very simple step, but it's actually very hard to do and to acknowledge and accept. But if you're doing that, you're actually really far along on the path. Then the next question is, well, then what do you do? If you're not trying to sleep, well, then what? Well, the answer to that is you actually start learning how to let go. You learn how to step out of that doing mode into what we call the being mode, which is learning how to be in the moment for what it is, accepting it as it is, and being non-judging of being awake, feeling patient that sleep will come eventually, and even if that means the next night or the next night. And it's really a trust that my body knows how to heal and sleep well, and I trust that I will cope and function the next day. As most of the time we do get through the next day. It's not easy, but we can do it. So this is what we call mindfulness principles. So when we learn to practice mindfulness and meditation, it's not just about the meditation, closing your eyes and sitting down and doing nothing for 15 minutes. What we're actually doing is cultivating these qualities. So we're cultivating the qualities of, there's 7 listed, but of course there are many other qualities that you cultivate in mindfulness, but these key 7 ones are really helpful to know and to learn and to keep them in mind when you practice meditation or being mindful. So non-striving, and I'm going to read out just some things that you can say to yourself at night time that help you resonate with helps you kind of cultivate non-striving. And that might be something like, I can't force myself to sleep, but I can allow my body to rest. Or there's acceptance. So it's okay that I'm awake right now. The moment is what it is. So you don't have to like it, but we're not rejecting it. The letting go is I release the need to control my sleep. Of course, that's really hard to do, and that's why we need to practice meditation regularly so we know what it means to let go of control. I won't read all of them because I've actually got a handout that you can download from the website, A Mindful Way to Healthy Sleep. And I really encourage you to do that. It looks like this. It's on the resources page of the A Mindful Way website. And I go through all of those 7 principles and how they're relevant to sleep. So please jump on and download that free resource. Essentially, what mindfulness is about is learning to shift from this trying to sleep doing mode into the allowing and letting things be, letting go of trying to sleep, reducing this sleep effort, accept wakefulness without judgment, and trust that sleep will come in its own time. So the 4th step, really, when you've recognized that I need to embrace those mindfulness principles and get out of that vicious cycle of insomnia and the agitation, then we can learn to rest in the moment. So it's absolutely okay to lie in bed and rest our bodies. And if we're resting in that very mindful way where we're not agitated or, kind of frustrated, quite calm, it's very restorative, and it's almost as restorative as sleep. Not the same, but we generally function a lot better the next day when we've had a very restful night in bed. So the goal and the aim is to rest in this very mindful way. Something we can control. We can't force sleep, we can't control sleep, but we can choose the way that we rest our bodies. So when you're resting, then you can focus on things like the softness of the pillow or the weight of the bed covers on you or the support of the mattress. and you can just follow the flow of the breath. And then just stay in this rested state really for as long as you need to. If you are finding though, because this is not easy, I know I might be sounding like it's simple, it is very hard to do, which is why we need to kind of cultivate mindfulness and practice it over and learn it over a 6 week period. But when you can do that, you'll find the night's very restful. In the early stages, if you're very agitated and frustrated and still finding yourself trying to use mindfulness to get back to sleep, then that's the time when you might go back to one of the earlier steps of just recognizing I'm in that insomnia cycle and the sleep paradox, and I actually just need to get out of bed and resettle myself, do something relaxing until you start to notice those signs of sleepiness, and then you can use the sleepiness to help you get back to bed. But coming back and again practicing the mindfulness of not trying to sleep, just simply focusing on rest. So these are the 4 steps again: recognizing that you're in an insomnia cycle, recognizing that there's a sleep paradox, apply the mindfulness principles, and then focus on resting the body and following the breath. So I know we've only got 10 minutes left. So Moira, I might just allow you some time just to reflect on mindfulness too, because you've mentored many people in mindfulness and sleep. I know you use this yourself. You've co-supervised many research papers and research studies on mindfulness and sleep. So I'd love your view on this too. We've got about 10 minutes left, so just a few moments and then we'll ask about questions. And while Moira's talking, please pop any questions that you have in the chat so we can come to those in a moment. But what are your thoughts on mindfulness?
Yes, well, I'm a fan. I think it's great. I think you've just done a really great summary of it all. I think you've hit the nail on the head that it's really simple but not easy. So this is the thing, and people think, "Oh gosh, I'm in this cycle. I've tried this, I've tried that, I've done it for decades, or maybe it's just recent." So I think it takes time. It's like a skill acquisition process, like learning an instrument, driving a car, learning your job. All sorts of things takes time. So I think it's an important thing that it's really cultivating your self awareness as well, and bringing in those CBT steps as well of just recognizing your thinking, recognizing your behavior, and we become preoccupied sometimes. Sleep insomnia becomes a preoccupation with sleep and a fear of not sleeping well. And I think mindfulness is a lovely soothing balm for those things. It actually maybe it doesn't fix it forever. It's sort of like something you have to always sort of manage. Maybe you are prone, most people I know with sleeping problems are prone to worry. They're a self-confessed worrier anyway, and all that sort of stuff. And a real high empathy, really. That's why, caring for people and caring for your job and caring about high standards and being sensitive sometimes, and then all these things that make us prone to insomnia. So I think, yeah, these principles are everything, and I really encourage people to at least look at this. Get that worksheet, or have a think about it. Start thinking about that immediately tonight.
Yes, thank you. And just a note on where you can go for further resources. So the Sleep Health Foundation is a great place to access a whole range of resources. There's really great fact sheets there, links to other sites where you can get some more information. And I'll let Moy just say a little bit more about that too, but we'll also just mention the Sleep Hub, which is a colleague of ours, Dr. David Cunnington, who has put together this incredible website with so many resources on sleep too. So it's a great place to go to get some more information, and the Mindful Way website, which I've talked about already today. But Moy, would you like to add something about the Sleep Health Foundation and perhaps any resources people can access that might be around perimenopause as well?
Just really just to go and have a look and look at menopause, look at women's sleep, and also from there, I would jump to the Jean Hales for Women's Health. We're a partner with them, and those of you who don't know Jean Hales for Women's Health, they are sort of our leader for women's health issues, and we've got links to them on Sleep Health Foundation. So just a little plug for them as well.
Yes, fantastic. There's a reference to the course again. We'll go to some questions now. So I might stop sharing so that we can take a look. there's a QR code if you want to access the website, but I'm sure you've all got the links to that. So I'm just going to go to the chat. I'm not sure if we have any questions here. And I'm mindful that people might want to stay anonymous as well. So feel free to email myself, or you can email Moira directly as well. And I'd be very happy to answer any questions that you might have, and very happy to jump on a phone call as well if you want to talk something through. So I think we might finish here then, Moira. We've only got a couple of
Yeah.
minutes left.
Did you want to do the poll? Could you think it's a good idea or you don't want to do the polls anymore?
I think we'll leave it. I think people might wanting to stay anonymous here, so that's okay.
Yeah, sure.
I really just
Yeah,
hope
we can
it was
finish up early. It's great.
useful for everybody, and I would imagine, like, I've worked with a lot of people on this area, and there are lots and lots of questions people ask. Mindfulness is not a straightforward, simple skill to learn. It really takes time, and it is very helpful to have a experienced teacher who can guide you through all of the things that come up. I can say that one of the most overwhelming experiences for most people who start any meditation or mindfulness practice is just how hard it is sitting quietly when you're someone who has a very busy and active mind. Um, as we talked about this stage of life, there's so many balls in the air, there's so many things to do. It just feels so hard sometimes just to find even 5 minutes to sit down and to actually close your eyes and do nothing. It just feels like the most difficult thing to do, but actually becomes the very thing that we need most when we are overwhelmed and the body's completely wired because we have little rest and little sleep. That when you do start learning mindfulness, and those of you on the call who might already be doing it, you start to recognize that this is just a resource that you can tap into that actually really rejuvenates you and gives you a sense of coming back to yourself and stepping out of that busyness of life, and being with yourself and life and the world in a very nourishing and different way. So there is a lot to learn. It's not simple, and I'm very happy to help people and guide people in that process because it's really helped my life and helped me with sleeping better. So I really believe in it. Um, so thank you again so much for joining. Moira, thank you so much for joining us today too. It was so great to have you as part of the workshop today.
My pleasure.
Really, thank you. And goodbye, everybody.
Bye. Thanks, everyone. Bye, Giselle.